This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
This is about laceration repair in the emergency department. We see a lot of lacerations, adults, kids, and we do have choices in what we use to repair them. Kind of the main choices we have are between actual sutures, where we have to numb and clean and suture, or skin adhesive, which can be quick and painless. But the question sometimes comes up is, will the repair be as good if we use glue as compared to actually suturing it? And especially with kids, it's nice if you don't have to numb and sometimes restrain a kid. So this was a study recently that looked at the options of either skin adhesive, suturing, or Steri-Strips, and actually randomized children with lacerations less than 5 centimeters that weren't too wide. And the main thing they looked at was cosmetic outcome as judged by the parents, which is kids, a lot of what we care about. Looking at 3 months, and also looked at like satisfaction and pain during the procedure. And in this study, the best result actually came from the skin adhesive. Parents thought that it was better results than the suturing or the Steri-Strips, and they also thought it was a little bit better overall satisfaction. So I think it's another good study. There's some other ones that have showed that skin adhesive is definitely not worse than suturing and sometimes better. And, so in the right patient where the wound's not too big or too gaping, it's a very good option. We can reassure parents that the wounds generally heal very well with something simple like skin adhesive. Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.